It is now 8:23 and it's time for Tech Central, and today we're looking at, well, answers maybe given by technology for your health. And we'll be talking about iSecure, which is an app. But let me introduce the guests we're going to be having that discussion with. And I'll start with my immediate left, where we have Dr. Diana Wangari, who's the co-founder of the app. Good morning and thank you for joining us.
Thank you.
All right. We also have Dr. Moka Lantam, who's the founder and CEO. Thank you for joining us.
Thank you for
Maybe
having
let me
me.
start with you, Moka, and maybe just tell us a little bit about iSecure. What is iSecure all about?
First of all, thank you for having us, and wishing all your viewers a fantastic and wonderful holiday season. Unfortunately, healthcare doesn't know seasons, so some families would be ill during this period and would be making very tough decisions about where to buy medicines, what can be afforded, and some families may not buy a gift for their child because they are buying medicines. So this is a very important time for us to bring home the message that using technology and recent advances in information technology allow us to really bridge the gap for some households. iSecure is one of the solutions in the marketplace that we would like to bring to their attention, which allows you to do one or two things right. Check the price before you buy.
Okay.
Know where you're getting your medicines from, and ask if you need help. That is the message of the season, and we are using technology to drive that message to as many households as we can.
All right. Diana, how does this work? How does, is it a mobile application app? Is it one that I use on my computer? How do I access it?
So it is a mobile application, but it also has a computer version, right? And a call-in feature. The basic message being that if you require help, if you simply look up iSecure, there are 3 different modalities, from a mobile application to a call-in feature, where you can really, look up medication prices and health information as well.
Okay.
Yeah.
So how is this different from Google? I could go to Google and, Google medicine and find out where to buy it. So how is this different?
That's a good question. As an app, we're achieving 2 things. One is allowing people to be able to follow a certain care pathway in a very secure environment, where they are creating a medical record which allows them to connect with the right provider, or which allows them to, in privacy, find the medicines they need and place an order. So when you're doing it in Google, it's a very general platform. You need to know exactly what you're doing. In iSecure, you can put fever, and you'd see the name of a doctor show up who matches with your symptoms. You can put Panadol, and you would see pharmacies that are currently carrying Panadol. And if you look at the name, if you click on the pharmacy, you would see how much it costs. So it's a very simple way to make the experience personal, make the experience local, at the same time giving you 3 things that you need to know as a patient. What am I looking for? How much is it going to cost? And where can I find it? Those are the constellations of decisions that are happening at any given time when you're faced with the decision of either looking for a provider or looking for medicines.
All right. Now, technology mostly is developed out of a need or something that, a gap that is there. Diana, what is it that this app is answering? What exactly are you, or what gave birth to this idea?
Yeah. Well, as a medical doctor, and most people will attest to this, is that you'll find you get about 3 to 4 calls in a day. Someone asking you, where can I get this doctor? Where can I get this medication? Where can I get, it cheaply or affordable, right? And so with that was the idea that there's actually a gap in there for information, and not just information, something that's personalized, something that you're sure you're getting quality information and quality services. So out of that, we thought, what's local that would actually resonate to the masses at their level, and that's when iSecure was born.
All right, and let's look at how credible the doctors and the pharmacies are, because I mean, in every business, there are those who probably would want to take a shortcut or make extra money. What procedure is followed, or how do I have a guarantee that the doctor that appears on my phone at that point in time is one that I can trust?
That's a very good question, and that's, again, the power of technology. With that, with the application, we're able to control the supply chain and the information that goes out there. So we vet the providers that are listed on the platform. We list where did you go to school, what are your degrees, what is your specialty, and as you see more patients on the platform, you are building your profile. It's like your LinkedIn profile. That is where you go to find out about another professional. In this case, you go to iSecure to find out about the doctor. Then you'd say, are they available? Where they are practicing? They could be in multiple hospitals, and what times of the day, and you can conveniently book an appointment. Now, on the pharmacy side, we work exclusively with 6 major suppliers who guarantee us quality and price. Now, our suppliers represent, on the one hand, the major multinational brands, and we have now over 5,000 items that we can guarantee quality and we can guarantee price. We are also working with local manufacturers who also guarantee us quality and price. We minimize our engagement with errant intermediaries to minimize the risk of including in our supply chain suboptimal drugs or drugs that are out of price. And so the net effect is that when you're in iSecure, on average, you experience a 30% lower price, either for services from the providers that we now have on the platform or for the medicines that you have. An asthmatic we're in Kakamega recently, and there was a lady who went to a dispensary. She was asthmatic. With the delays in the supplies, she was in a state of status asthmatic, because that means a severe asthmatic crisis. She hadn't had her asthma medication for 30 days. Through the application, we're able to get it from Nairobi to Kakamega at a cost she had never seen before. And this is an adult female. So that is the power of technology, because at the end of the day, if we just do efficiency, we have not really solved the problem. It must be efficiency that comes with affordability and access. And I really want to underscore this point, because we have the technology platform. Not everybody has access to a smartphone. So we've also have a distribution network where we're setting up hubs with connectivity in rural, underserved markets, where you can now go to and use the application. Your order would get to the right source, and you would be able to get the medicines depending on the pharmacy you choose. So it's really transformational, and we are certainly appreciative of the 18,000 first users we have on the platform. We are appreciative of the 500 providers that have created their profile so far on the platform, and there are 50 pharmacies as well. It's work in progress, but I think we are well on the journey towards transforming how people are now engaging the healthcare system.
Okay, now any system is subject to abuse or somebody coming in and infiltrating. Are the normal procedures followed? And by this, what I mean is there are those who would want to abuse drugs for whatever reasons. And there are certain drugs that you cannot get off the counter unless you have a doctor who was assigned for obvious reasons. Yeah. Now, is there a way that I can get whatever drug I want through this application, or are those procedures still followed?
The procedures are still followed. The first thing, you would find that most of the medication that are over the counter, obviously you can just purchase directly through the application. But if you have a prescription medication, the first requirement is actually to enter the prescription. So you are able to provide us with a prescription. On our end, we're able to verify the prescription is authentic, and at that point is when we're able to dispense or send the information to our pharmacy.
How do you tell an authentic prescription? Because I could write one and sign. I mean, and you know how doctors write.
Absolutely.
You're a doctor. So it's handwriting that cannot be read by anyone.
Absolutely. So we have two systems in place. One is we do ask your provider, your doctors, to send us a prescription directly. So if you do see a provider within the application, you're able to get that provider to send us the prescription directly. So we have verified the provider, we get that prescription directly. The second bit of it is if you do have a prescription, we have to ensure you're within the master database of facilities. So it's not a random piece of paper. It's a paper which we know it's Mater Hospital.
It's authentic.
It's authentic, right? So we check either directly from a provider provider or from the facility point of view. Yes, yeah.
All right, and one other problem we have as a country is self-medication. How do you ensure that people are not just self-medicating? Because they may not be out to abuse drugs, but there's also a challenge in self-medication because you might be taking the wrong medicine since you've not gone through the necessary tests.
Sure. So that's, there are two sides to that equation. One important side is that is self-medication an indication that people are shopping? It's an affordable way to get access to care, to say, okay, let me first buy my medicine if it doesn't work before I go to a doctor.
Correct.
Right? And it's part of the customer journey we are experiencing. You say, well, it may take me 6 hours to go wait in line, find the doctor, then I miss work. So the default option is to self-medicate. Now with technology, we're reducing that barrier. And so in a way, making it convenient for people to engage in a digital environment within the convenience of their home. And so I think we can say part of our technology strategy should reduce that. However, the 20% of people who are sick know what it is that they want, right? And so we also have to embrace that reality that some patients really know what they're looking for. And so there is an opportunity for them to engage in the digital environment to say, okay, I'm looking for salbutamol, I'm an asthmatic, I take it every month, or I'm a diabetic, I've been prescribed insulin for the last 10 years, I know what I'm looking for. And so now the question is, where is it available and what's the price? So we are accommodating all those scenarios. Obviously, it's a very fluid environment, the marketplace. What we guarantee is that, first and foremost, we are working with the right suppliers. We are certified by the Pharmacy and Poisons Board ourselves as an application to make sure that we as intermediaries are also meeting the requirements and also working very closely with the national bodies to make sure that the providers and the facilities are registered facilities. Because here's the trick, you know, in the case of pharmacies, there are about 11,000 pharmacies throughout the national territory. 4,000 are registered, 7,000 are not. So the probability of engaging an unregistered pharmacy is pretty high. It's pretty high. So we really have to manage those dynamics and be very disciplined in what it is that we are offering and really allowing people to get a sense of comfort. That's why we say, trust yourself. You've got to trust yourself, look for the information, and hopefully we can help people get that information, as Dr. Wangari mentioned, you know, just when they need it. You know, that's another thing in healthcare more than any other consumer market. Usually, if let's say you know your preferred food, you get it anytime. Healthcare hits you when you least expect a disease, and it's at that moment that you need to start making the right decisions. So it is a very, it is very important that people embrace the opportunity that you may not need it today, but when disaster strikes, you know, where you're helpless and you have a $50,000 medicine bill in front of you, 30% is big money.
All right. Dr. Wangari, run me through how I'm interested, how do I get the application, and what is required from me?
So you simply go to the Play Store or App Store and download iSecure. And just like, you know, M-Pesa, you need a mobile number and a PIN. You register with your mobile number and a 4-digit PIN. And that's pretty much it. So on the provider side, you require a little bit more details because, as we mentioned, it's more like a LinkedIn for doctors. You have to say, you know, where you went to school, you know, which facilities do you practice. But for the patients, really, once you log in with your mobile number and your PIN, if you have insurance details, you can put that in there. And once you get on the screen, it's simply a matter of identifying which location. So if you're here in Nairobi and say, for example, you have your grandmother in Kakamega, for example, yeah, you simply write, hey, Kakamega, right? Find a doctor. Do you want to buy medicines? It's all in one screen. Click on buy medicines. Which drug do you want? Do you want Panadol? Do you want insulin, right? You're able to actually check. This is the price. The standard price for insulin is say, is it 1,000? But usually in this pharmacy, it will be 500. So you're able to do the price comparison. You're able to check doctors based on which location they are. You're actually able to even see, what time period they're available. And that's pretty much it, as long as you have that mobile number and PIN.
Okay, and how spread out is your database? Because this is okay for those of us possibly in the urban areas, Nairobi, Mombasa, Kisumu, but you have some who are in very remote areas. Is this app still available, and does it work, or would one have to now travel to an urban center where you'll find the doctor or pharmacy?
Sure, very important question, Michael, and a part of our strategy and process is setting up hubs in underserved markets. We currently have 7 hubs that we are now modeling. A hub is a place where there is connectivity and a smart device with the application. So you don't need to own a smartphone. You could borrow a friend's phone, or you could go to a hub and be assisted. Our goal is to have about 290 hubs throughout the national territory within the last year. And so we're inviting our friends to nominate communities where there's no pharmacy, communities where they are having challenges accessing medicines. All you need is a 3G signal, and then you pretty much can have a hub. With that, now you can go there and go through the process that Dr. Wangari just mentioned. You put in your name, put in your number. It's simple. It requires some effort. It requires some thought. Within 5 minutes, you're done. And at that point, you can now either assisted by the hub captain, or if you are savvy enough, you certainly can do it. The opportunity here is to say, if we really want to see a change in terms of how communities are accessing medicines, we can use technology to empower ourselves. And through technology, we can know exactly what is the right source, what is the right price. That is huge in healthcare. There's a Swedish saying that, he who buys what he does not need or more than what it should be is stealing from himself. And if you think about it in the case of medicine, where 20% of households are sick every month. In Kenya, there are over 8 million households. That is 1.8 million people who need to make a decision every month. It is massive. And so we are using this opportunity, especially during the festive season, and really appreciate it, to say we have to take action and support and make the first step towards universal coverage. That means making sure that we know where to get first of all, access to information, access to price, access to service. That is what we owe ourselves as citizens, and as the beneficiaries of a good healthcare system. We must play our part, and hopefully technology would help people do that.
All right, Dr. Wangari, once I've identified that a doctor is at place X or a pharmacy is this number of kilometers, is there delivery services, or does that now give me do I have to go to the actual place physically? Is there a facility for delivery is what I'm trying to find out.
So if it's a doctor, you actually have to go see the doctor in the first place, You might choose to follow up post the first visit on phone or, via chat within the application as well. But for the pharmacy, we actually do offer delivery services across the national territory. You could be in Turkana, you could be wherever you are.
There's an extra price?
Dependent on which medication you're getting, because if you're getting Panadol, obviously if you're shipping it out there, it takes a bit of, there's a price factor towards it. But if it's a large quantity, then there's no price factor towards it.
Okay, and is that something that I'm able to get on the app in terms of if I'm in Turkana, for example, and I need that medicine that is only available in Nairobi, but you're willing to bring it, do I get all that information on the app of how much it'll cost me, or is it something now that I'd have to negotiate?
Yeah, you actually get it within the application, and that's why the hub is becoming a critical factor. What we're saying in areas which necessarily you might not have the community having smartphones, we're willing to work with the community, to support the community, to set up a hub where we'd put connectivity in there. We'd put actually a smart device, and you'd actually come and get all that information within the application. So regardless of where you are actually, you'd be able to find all that within the application, whether it is with your own handheld device or it's within a hub setting as well.
Okay. I don't know how far you've gone in developing iSecure, but what about those who would probably want to travel internationally? Can I use the same app, outside the country? Because that's where I'd probably need more information. I may be very well versed with my home area, which pharmacy, which doctor, but once I travel, then that becomes a bit of a challenge.
That's correct. So with iSecure, you can be anywhere in the world. You drop PIN in the country of interest. Right now, we are in Kenya only. You would select a pharmacy that is listed in the platform, and it should be able to, you should be able to get medicines. Now, through the platform, we have a couple of pharmacies that are able to ship to you throughout the national territory. These are special arrangements under what we're calling the Access to Medicines program. So they have guaranteed below market rate prices, and they are also willing to work with the patient to ship. Obviously, it's important to confirm delivery location. It's important to confirm delivery times because people are quite mobile out there. And we can also deliver in offices and in homes. So it is really technology backed by services and backed by quality suppliers. That combination is the winning combination to make sure that, you know, people's orders get there on time, people on time exactly at the price that that were given, and also the right quantities, and that really makes for huge customer satisfaction.
Okay, yeah. You'd mentioned that there is a mobile application, but there's also one that you can use on the computer. Is there any difference between the two?
Well, the computer aspect is really more on the pharmacy basis, because if you're a pharmacy, you have stock you have to manage, you have to check those orders that are coming in. So we put the computer platform is really on the supply end of it. Then for patients, that would be now the mobile application or a call-in feature as well.
All right.
Yeah.
And those would probably want to engage with you. We've mainly dealt on the consumer side. What about the supplier? What do they need from you? Do they need like verification for them to be on the platform?
Yeah, there are requirements set by the Pharmacy and Poisons Board about what wholesale suppliers must provide, or persons who are ordering medicines above a certain quantity. So we would need your premise license, your practice license, you know, offered by the Poisons Board to approve you on the platform. So we provide the service to them, we onboard them, create their profiles, help them create their inventory, and within 4 hours, they are online.
Okay.
And can start transacting. You know, it is there is a behavior change curve here that we must embrace. And so, you know, like everything, you're set in your ways, you know, but, you know, the world is going digital. And so it's not natural for everybody to create their LinkedIn profile, if you will. But once you create it, then now many things start happening. And so it's the same experience, the same journey.
Experience.
And so we offer that service to the suppliers, to the pharmacists, to the providers. So if you're a doctor out there, you believe in making yourself available to solve people's problems, call us, and we would enroll you and create your profile for you. You have nothing to do. We do it for you. If you're the patient, obviously there are millions of people. We can guide you over the phone, or once as you enroll, you're going to get a series of videos that would give you sort of like how to sign up, what to do, how to buy medicines, or how to book a visit with your provider. All of that is now automated.
It's available.
Yeah.
All right, Dr. Wangari, as we wind up, possibly just give us the how to download it, because as we say, iSecure, I'm sure our spelling is very different. So it might be good just to get the right spelling and the right thing to look for.
Yeah. So first the spelling, it's iSecure. You can get it on the Play Store, but we also say, I mean, there's Facebook, there's Twitter. You can find us on those pages as iSecure, but you can also call us on 0717-439-062. So pretty much we're able to walk you through the application. We're able to take you through on how to create your profile. We're able to even take you through, are you searching for this medication? And you might not necessarily know the spelling of that medication. Right. We're able to do that with a customer service.
All right, because of time, we'll have to wind up that right there. Thank you very much, Dr. Diana Wangari and Dr. Mocha Lantam, for joining us this morning and, well, updating it on iSecure. And, well, that's where we wind up your, well, what do we call it? It's Tech Central that we wind